What diseases can LDN be used for prevention? You know, when I talk to other compounders, they're always like, well, who else can we look at? And this question is brilliant because when I was first getting into this discussion about the health prevention, there was a paper that was discussed at the last LDN conference, Dr. Zala, and he said over the last 8 years, he started seeing all the biomarkers of health have improved in my patients who were established on an LDN protocol. And we saw a hypothesis paper in about 2009. That was the very first slide I had that they said, hey, look, we can offset a lot of these inflammatory markers that we see with chronic health conditions. So the question is, which ones can we prevent? So this is like a really big discussion. And Linda, if you really, really want me to get into it, we can do this one for the LDN conference. I would love to talk about this. But here's the list. All of them. That's how easy it is for me, because so many of these diseases that we see that start in the age range of about 45, it's a combination of factors. It's epigenetic factors of expression due to how you've been living for the last 10, 15 years of your life. If you've been smoking and drinking and partying and carrying on like you're 21-year-old and you're 47, it's going to catch up. And that's what they talk about, these lifestyle pieces. Because it causes this expression of your epigenetics, your baseline. You keep hitting the reset in this expression, and then you have all of this oxidative damage that's occurring. And this is actually a total discussion about mitochondrial dysfunction. And you see this onset of almost all chronic diseases at that age range of 45 as a result of chronic inflammatory degradation in the system in conjunction with mitochondrial dysfunction, as along with obesity and sedentary lifestyle. It's like, you name it, take one. Aging lung. I talked about that at the last LDN. Aging lung is a consequence of just being alive and breathing the air that you breathe. And if you're in a really highly polluted area, it's going to hit earlier. The cleaner the air and the better you take care of yourself, the longer it will take. We're all going to get there. Inflammatory mediated. Cancers. All cancers are chronic inflammation pathogenesis with other precipitating factors. There's a lot more around it, but if you remove the inflammatory components from all of these diseases, you delay the onset of all of them. All of them. So if you are currently in clinic with patients who are over the age of 45 that aren't sick, what do you say to them? Do this, this, and this to prevent these diseases. Consider adding do this, this, and this, and start low dose naltrexone at a lower dose, somewhere between 0.5 milligram and 2 milligrams, to prevent the onset of those inflammatory byproducts that cause these diseases to progress. Cardiovascular disease, inflammatory in nature, all pain, all rheumatoid arthritis, all of these other disease states that you see that are chronic inflammation progression is a result of your immune system just kind of falling apart after 45.